Guys, this is a very special episode of CD2, a case discussion engaged with my own life experience. So, I hope you will love it. Let me know how it felt. There are some days in our life where the days doesn't go as planned. How much you plan to succeed, it will always go how it is destined to happen. This CD is one of them in my life. If you have been following me from the beginning, you would have known that I have been doing these live sessions early in the morning where I have been interrupted due to some Wi-Fi issues at my home. And now this unplanned, unpleasant kind of vibe of Scorpion sting has happened. Let me take you through 2 day journey of Scorpion sting and how I felt, how I was treated. Includes all of the information that you need regarding Scorpion sting, as well as the patient feels, how it feels for the patient is what we talk about here. This is not just a podcast of how you should behave as a doctor, but also how you should feel in the place of a patient, and also how I learned the lessons of the future. So, with happy faces, let's begin. We all love stories, right? So, let me begin with the story of how I got a scorpion sting. So, please be patient for the next 2 minutes while I tell my story of how I got the stung. So basically, I would have been happy if I got the stung somewhere along the road because I live in a rural area, but it's not the case with me. I really am surprised of how a just fine normal day has turned out to be scary day where I bought clothes from my cupboard to change into night suit. A sudden rush of pain hit through the right calf of my leg. Who suspects a pretty normal day would bring a scorpion inside my night suit? Whoever expects it to be happening? What happened? Because the pain hit through me, I just tried to remove the suit, and then it again bit me in the right ring finger. This is the finger, so it hit me in the right ring finger again because I didn't expect it to be a scorpion. Usually the scorpions are not the case. Unknowingly, I tried to remove the suit, where to my surprise I found a scorpion. And the rest is history. From now onwards, I'm gonna use the terms like pain and vein in exaggeration because trust me, that's how it is. That's really how it is. For the next few moments, I was nowhere near behaving like a doctor. I was this patient who, runs out in agitation, panicky state, remembering me that I was also a human. The first thing that I was doing at that moment, the first thing that shook my mind immediately after the bite was click a picture of scorpion. Not to know the type basically, but it was just an instinct to click the picture of the scorpion, which is a very blurry photo, of course, that I will display it in here on the screen. I really shouted, asking for my mom. I just called my friends and told, this scorpion has bit me, what to do next. I really don't remember anything about scorpion bite at the time of the real bite for me. Being a patient is not very new to me because I have had a dog bite 2 years back and an accident 6 months back, and now a scorpion bite. I don't know. I really hate animals for some unknown reason, and now this makes me hate animals even more. I am really hoping this video will help you in any way possible. Okay, coming back to the story, what I did was I went to some hospital nearby. So this staff nurse came running to me, took my vitals and also my BP, all the vitals kind of stuff, and informed the doctor about the scorpion sting. So that the doctor also came to me while I was crying in extreme pain. I'm literally stressing this word because that's how it is. That's how I would describe it in terms of a patient, because the pain is like, I can't even describe it. It is like, there was so much burning sensation all over my right calf of the leg and this right ring finger. It really is not so good. I will tell you what doctor has did in a better understandable way. So whenever a person comes to you with a known scorpion sting, that yeah, I have seen the scorpion biting me, so then what's your protocol? First of all, you will once again confirm it, the bite site, by just tapping the place. Like, it is very specific to the scorpion bite that usually the patients with scorpion bite will have excruciating pain when you tap at the bite site. For suppose this is the bite site for me, so if the doctor has tapped here, The pain is really excruciating. Any doctor would first like to know about the type of scorpion. Like as I said, it may be Indian red scorpion or black scorpion. It is Indian red scorpion, like in the case of mine. Usually it is more prevalent in Maharashtra, AP, Orissa. In black scorpion, most commonly seen in Kerala states. Took the photo and shared it with the doctor. So he has confirmed it as Indian red scorpion, which is far more dangerous than black scorpion. Black scorpion usually has less pain and swelling compared to Indian red scorpion. Indian red scorpion usually can cause severe cardiopulmonary and neurological symptoms. That's how it differs from black one. So I was unfortunate to have this Indian red scorpion bite. But then how I tackled it. Let's move on. Coming to pain once again and for the last time, that this is the worst pain of my life. Even when I had the accident, the pain has subsided with the painkillers, but for me, burning sensation doesn't subside because it is an Indian red scorpion. So to confirm, the doctor has done an ECG to rule out any arrhythmias if present, and also regular BP monitoring, because that is the most important part of scorpion sting. You have to monitor BP throughout the night, at least for 14 to 24 hours. I was fortunate enough to not have any BP spikes in the monitored period. So what the doctor did was he gave me symptomatic treatment. So coming to treatment, how should you treat a patient with scorpion bite? As I said, the pain is extreme and the burning sensation is very extreme. So you have to take care of the pain first. So if the patient is having any kind of BP spikes or neurological symptoms like hypersalivation, any kind of confusion, or both sympathetic and parasympathetic kind of symptoms can be present in scorpion bite, so you have to monitor both of them. If any kinds of these symptoms are appearing, then only you should go for the antidote like prazosin. Usually, like anti-snake venom, we also have anti-scorpion venom. Of course, like in rural areas like mine, you would not see any of the anti-scorpion venoms here. So the alternate you will have is prazosin. Now, I am telling you, now you should not forget about prazosin, especially after having this live experience to you. So the scorpion bite, the antidote we prefer is prazosin. The dose is very important. Usually, how to not forget prazosin and how to not forget the dosage of prazosin, that is what I'm gonna tell you now. I will tell you a little bit story about this. So for prazosin, it is available in 2.5 to 5 mg tablet. We will not have IV suspensions here. We will give oral tablet of prazosin to the patients. So usually this tablet is available in a sheet format. One sheet of prazosin costs around 400 rupees. And if you want to buy a single tablet for scorpion bite, it will not be available. You have to purchase the entire sheet. Sometimes the price may vary from 400 to 800 also. Near my hospital, it was around 800. So I can't purchase one tablet. I have to purchase entire sheet where the sheet gets wasted. What you will do is you will give prazosin only and only if the patient is having any neurological or cardiopulmonary symptoms like arrhythmias or confusion or hypersalivation or sympathetic surge, tachycardia, like these symptoms. If they are present only, then only you will prefer prazosin for the patients. You can prefer this prazosin in children also. How? You have to remember this dose 30 micrograms per kg. If you do not have prazosin which is readily available, you can also prefer labetalol for the same. Apart from prazosin, what the doctor has gave me was symptomatic treatment. There may be an anaphylactic reaction to the toxin, so I have got an injection Evil and injection Texa beforehand, immediately 10 to 15 minutes after the bite. I just added clippings of the videos at the hospital, how it felt. It is also equally important to know these kind of bad moments to learn many lessons of life. So there are some takeaways of this particular story that have happened. Many of us, including me, we are just exhausted of extensive schedules or tight schedules that are given for us by the government sector or private sectors, that one patient comes to you and pokes to you in pain, continuously, you will get irritated. But I know how it feels, how it feels irritated at one or the other point. You will feel like you just want to vent it out. But trust me, just be a little more patient for that next 1 or 2 minutes. Then the patient will be happy and you will also be happy. You will not regret it afterwards, because being in a patient's place, I understood how having that pain will affect you to even I felt like I was continuously poking the doctor for unknown reason. Being a doctor, I was continuously asking the doctor to do this, to do that, to ask everything that went out of my mind. So just be a little more patient to the patients. So that is my first takeaway of this story. Whenever something unfortunate happens to me, or something like this happened to me, I always felt, why this is only for me, why it is happening only to me, or why this has just happened. Why that normal day will always went up in some random unfortunate day. This is what I always thought, and then I realized maybe something worse would have happened and God have prevented me from that being happening. So everything happens for our own good. That is what we have to realize in life. If you are if you are an NEET aspirant, and if you have tried your level best in NEET PG, and if you haven't scored it, you got some disinterested branch, it's okay, it's fine. Maybe you are destined to become a good surgeon or a good doctor in that particular field, or maybe in that particular branch. Never ever take underestimate yourself of these silly things. There is more, far more better life than you expected in life. Okay, we started somewhere along in the childhood and we end up somewhere in our adulthood. That is not completely in our hands, so just leave it to the destiny, and be happy with what you are having. And, finally, I can't end this video without this note, that whenever, if especially if you are living in rural areas, please, please, please check your clothes while drying, or while folding the clothes 1 to 2 times, so that no scorpion or snake enters your clothes, just like me. That is a moral, personal moral story of mine. So I hope you enjoyed this CD of informative, funny experience of taste of seven that I have got on my way till here. I really am blessed to have you as my family. That I really cannot imagine how many messages I've got regarding my scorpion bite. I have successfully recovered. Thank you so much for watching this video. Happy Valentine's Day. Thank you so much. Bye bye, guys.